Go. All right, everyone. We're going to give just a minute or two for everyone to be able to join here before we kick off this webinar today. Looks like everyone's joining in. All right. Let's see. Almost still a couple people filtering in here. All right. Think we got everyone, and there'll still be a couple that trickle in here as we get going. Um, my name is Nick Leonardi, VP of Marketing and Strategy with Utility Business Media, and I want to welcome you to today's sponsored webinar with Avive. Today we have with us Kelly White Amin, who's our National Account Manager, and Mark Peters, who's the VP of Sales. Today's topic, we are covering AED programs in 2026, from do we need them to can we trust they'll work. We encourage you to stop by their booth. Their booth number is 121 at the upcoming IP Utility Safety Conference in Orlando next month. And if you haven't registered for that, please make sure to do so. This webinar will be recorded and be available 24 hours after the webinar concludes and be posted on incident-prevention.com. Please ask all your questions in the Q&A panel, and we'll go through and answer them at the conclusion of this webinar. Proof of attendance will be sent via email from Zoom directly 24 hours after this webinar concludes. And with that, I hand it over to you guys and thank you for being here.
Yeah, thanks a lot. And good afternoon, everybody. Really excited that all of you were able to join us this afternoon. We're hoping to give you the next, 45 to 60 minutes of some really good information and hopefully can get each of you thinking a little bit about your organizations as you take this back to them and explore some further conversations. So before I get started, I wanted to give a chance to Kelly just to briefly introduce herself, and I'll introduce myself and we'll jump right into it.
Hi, good afternoon, everyone. My name is Kelly Whiteamine. I'm the National Account Manager here at Avive Solutions. I'm excited to be here and looking forward to the next hour of conversation. Thanks, Mark.
Yeah, thanks, Kelly. And again, my name is Mark Peters. I'm our vice president here at Avive. I've got a pretty interesting story that I always like to tell before we jump into these types of presentations. So I wanted to start off a little bit on that. I've kind of made it my lifelong mission to talk about cardiac arrest for two key reasons. The first reason started when I was 15 years old. My best friend collapsed in a high school without an AED, and unfortunately, he did not survive. So at a young age, I learned a little bit about what is an AED, what is a heart attack, what is a cardiac arrest, right? And it took a lot for me to understand why my close friend did not survive that incident. Where my story gets a little bit more interesting is if you fast forward to 2009, February 25th. I was a 22-year-old, recently graduated from college, moonlighting as a personal trainer in a gym outside of Philadelphia, and I didn't feel good the entire day. Was in the gym. And at about 6 o'clock that evening, I collapsed and went into cardiac arrest myself at 22 years old. And I was fortunate enough that there were the right people there at the right time that ended up getting me care as quickly as they could. And I am now here today. I share that story because it's two great examples of these very real situations that happen much more than we think. And it's why many of you on this call have already made it a priority to talk about or implement AED programs at your own organizations. And it's why we wanted to be able to open that topic up a little more to talk. As we go into the presentation, I think what's always fun is anytime I have a chance to work with utilities. I always talk about the fact that I come from a family who my father was a 50-year lineman, lied on his lineman application to get to lineman school before he was 18, and joined, and he spent 50 years with Jersey Central Power and Light. So being able to talk to all of you, knowing the danger you put yourselves in every single day, and more importantly, having intimate knowledge about what that job requires, it's an honor to be able to have a chance to hopefully be able to give you some good information and talk further about how you guys are thinking about cardiac arrest in each one of your fleets or your overall organizations. So let's start with what you guys now see today, and let's try to make this real for each of you, right? So at the end of the day, you guys are going to be responding in the harshest of conditions weather climates that nobody leaves their front door, let alone gets in a car for, because you guys are there to help support, just like this picture shows. So let's paint a picture of what a real cardiac arrest could look like. You have a storm response. Let's say that you are doing some mutual aid in an area that just had a hurricane and your crews end up going down to be able to support them. That crew starts during that initial 12 hours of being on site, one of the workers collapses. You guys know there's an AED somewhere in that truck. What's next? How does your crew respond? How do they know how to respond? What sort of training is being done for them to be ready and prepared to be able to have the positive outcome that we want? A lot of what we're going to talk about today is going to fall around that specific confine. Readiness, not accessibility, is what's going to determine that lineman or that linewoman's life being saved. And that's what we want to talk to you about today. So as we jump into this, what we wanted to start off was with a poll. So I'd ask if all of you guys can take a look and listen as we give you these two poll questions. This will allow for us to be able to understand a little bit more about the audience that we're speaking to and hopefully tailor the discussion for the next 30 to 45 minutes about that.
Yep, and you should see that poll live there for poll question number one. Does your organization currently have AEDs deployed? If you're on here, if you could please answer that question, yes or no. Thank you so much. Give it just a couple more seconds, see if we can get everyone there. We got about 60% of the folks that have responded. All right, and I'll go ahead and end that and share the results. Should see them on screen.
Excellent. Great to see. Okay, now I know we're going to have a second poll question, I believe, too, that's going to come up.
Yep, let me launch that here.
Excellent. Thank you.
Back. There we go. Sorry about that. And our second question is live. How would you best describe your current AED program readiness? Are you fully prepared, partially prepared, not prepared, or just not sure?
And I
Yep.
think our idea about thinking about this question for the group that is listening in is we want to better understand as you guys think about doing it one way or doing it potentially how we think about the right way in 2026 and be able to talk to you a little bit about what we consider fully prepared, what the industry is moving to in fully preparedness versus where you guys may think you are today.
All right. Looks like we're about the same here. So I'll go ahead and share these results.
Excellent. It'll be fun to dive into a few of these things with everybody. I think it's first of all, kudos to those who responded fully prepared. I think it's a challenging task to undertake implementing a safety program of this magnitude. And as we are talking to you more here over the next few minutes, I think you're going to see some areas that you probably have already done if you're fully prepared. For those of you who are partially prepared, we're very, very excited for the Q&A session and for the other responses similarly there. We are very much looking forward to continuing dialogue with you all, whether it be post this call or at the trade show that's coming up here shortly. All right. So jumping back into things, I wanted to spend a couple minutes talking about the progression of AED programs. I think I've been fortunate enough to be in this industry across different manufacturers, and we've seen over the past 15 years where AED programs once started to kind of where they've gone to. And I think this is a good slide that allows for us to segue into the broader context of the dialogue. So if you think about AED programs 10, 15, 20 years ago, that's when AEDs were not necessarily driven as a commodity-based solution, which is some of what is the challenge today. This was an area where you had the early adoption curve and you had folks that were doing this for the right reasons. And one of the major challenges during that time had a lot to do with the maintenance and the ongoing program readiness during that. Part of this was on the manufacturers themselves, right? Of the five or six manufacturers at that time that were selling AEDs in the continental United States, for the most part, those devices, right, all had certain requirements to be maintained, right? And in an individual manufacturer's manual, otherwise known as an IFU, an indication for use, every manufacturer talks specifically about what is required when you have that AED to be able to document maintenance within. And back then, there was a lot of manual touches. These traditional AED programs relied on human beings to be able to touch a device. And that touch was in a frequency that could be daily, could be regularly, could be weekly, but all of that was required based on the product that you had. The challenge with that, as we all know, is any sort of safety program that is decentralized, there's always an error for risk. And we started to notice during that time that there were obvious ways for us to be able to move from a traditional human interaction, human touch, human maintenance, dare I say Excel spreadsheets to maintain your product to kind of this next phase, right? And this next phase is something that really only has started to come to wind over the past 4 to 5 years, which is this concept of remote monitoring, where you have some sort of hardware software function that sits by a device in a cabinet somewhere that can hear or visually see the device and be able to provide some sort of status update on that product. So a couple examples of this would be you could have a product that potentially has a camera looking at an AED manufacturer's ready indicator and reporting back that information. You may have a device that has an ability to hear something out of another manufacturer's product and ultimately report that information back. But that setup is limited in the sense that it still requires the AED manufacturer itself to ultimately be pushing information into the monitoring solution to then capture it and bring it through. Many times that monitoring is based off of some Wi-Fi connectivity or in some cases cellular, but there is still a missing component. And that's where we bring it to this third stage and candidly an area that we're trying to take on head on, which is our product and the nativity of that product to be able to push that information as opposed to pulling that information. Said otherwise, rather than you needing something to be able to capture, everything is being done automatically for you. Set it and forget it. Today, the challenge that we face and others in the AED industry faces is oftentimes, and we get it, not everybody has the passionate story of a Mark Peters, it's a check the box solution, right? They want to be able to capture the idea of needing an AED, whether it be a requirement based on a state you may be in, or because you know it's the right thing to do as a safety leader. But we are now trying to take that conversation from a check of a box and a device being available to how we define readiness, which ultimately enables all of you as safety leaders to be less hands-on and allow for technology in 2026 to do that work. So really, when you think about the poll question, what we're trying to get down to is, as a safety leader on this call today, can you unequivocally say that you trust that your AED program is going to work when it matters most? So how do we think about that idea of trusting an AED program? The first thing we're going to talk to you guys about is how do you evaluate what that means to be ready, right? Not just deployed, just like how we started the conversation, having an AED and checking the box, but ready that in that chance that is a high probable situation that there is going to be an outcome of a cardiac arrest, that every factor of the chain of survival is adequately working for you to be able to save your colleague or your coworker's life. The second area that we're going to spend some time talking about is where we have seen, especially in recent years, AED programs breaking down. And oftentimes this has to do with a distributed environment or a decentralized environment where, unfortunately, us as human beings, we get busy. We're not thinking about AEDs every day of the week like Victoria or Kelly or I. We're thinking about a myriad of other things. And based on that human error and or human interaction, what is truly breaking down? The third thing we're going to do is we're going to define a best practice of what operational readiness looks like so that for those of you who responded on the poll that you feel like you are in a good spot, give you something to check a box against, right? And then lastly, we're going to talk about some practical steps that each of you can take to improve upon, to build upon, to expand upon, or for some of you who don't have an AED program today, ways to be able to start that program from scratch and do it the right way from day one. All right, so let's talk about the reality and why the stakes are high. I'm sure many of you are aware of some of these statistics, but no matter which way you cut it, in the world of utility, the risk is as real as it gets, right? Um, Speaking from my father's experience, he had been electrocuted twice on the job, right? Survived both times, thankfully, right? But this is something that is very real for every lineman. This is something that is very real for the work that you guys do day in and day out. And that puts you at a much higher risk. In fact, it's a 7 times higher risk that you guys are going to have that sort of electrical based injury or potential fatality than the average worker in the United States. Now, there's about 25 deaths a year that OSHA looks at when it comes to electrocutions of linemen. I know from my dad being on the job for the time that he was, there were several folks that did not survive challenges and incidents over that time. And that's a regular fear and that's a regular risk that every day each of you put yourselves in front of. The third thing that we know to be true is that seconds matter. One of the big conversations oftentimes we have with utilities is not so much about their fleet. We know if you've got vehicles on the road or bucket trucks on the road or supervisor vehicles that having that AED available is critical because you know you may be in an area that's 20, 25 minutes, 30 minutes away from EMS being able to get there. But the conversations we typically have is around the real estate. And we've spoken with customers in the space that say, hey, I have a building that's only 5 minutes away from a hospital. Why do I need to have an AED program in that hospital? Or, hey, I've got a building that sits adjacent to a volunteer EMS squad. Why do I need to have an AED there? And at the end of the day, the statistics don't lie. For every minute that there is someone in cardiac arrest without a defibrillator, it reduces their survival rate by 10%. Simple math. 10 minutes, 100%. We want to be able to avoid that at all costs. And those two incidents that I talked about, the ones that we talk about with clients, yes, that volunteer ambulance squad may be right next to your headquarters, but those are volunteers. They're not there 24 hours a day. When that 911 call comes into that operator, that 911 call is then going to dispatch those volunteers. Those volunteers are going to take time, oftentimes leaving their full-time jobs to get to the ambulance and then ultimately arrive on the scene. This happens in many states around the country. The same thing would go for a hospital. By the time that that 911 call gets to where it needs to, by the time that that dispatcher, who does fantastic work in every community around the country, but the reality is those dispatchers follow a process. And when that process gets to the point to dispatch, we're talking about many of minutes. We want to address the most critical point of a rescue, which has to do with that initial 10 minutes, from 0 to 10 minutes. And we want to be able to address what we call the 2% problem, which I'll talk about in a couple minutes. The reality of this situation for you all on the right-hand side is absolutely real, right? I talked about the distributed workforce and those remote crews. I think about my father in New Jersey, being in the Pine Barrens of southern New Jersey, an hour and a half from the closest hospital, right? An hour from the nearest EMS, 45 minutes from law enforcement. That is an area that just geographically is a quote unquote dead zone, right? We need to be able to capture that as we all look at evaluating our own programs too. The complexity of these environments are enormous, right? You have mobile fleets, you have fleets that may be with certain folks depending upon where they're at and where they're deployed. You're going to have fleets that are going to be stationary in buildings. All of these different examples of where these devices end up being deployed require somebody today to have eyes on them or ears on them. And if they're not doing that, we don't know if that device is actually going to work when it's needed most. Third, each and every one of those crews are going to be a part of that first response. Now, I know from experience that there's a ton of training to be done, and every year, multiple times a year, many of these organizations are putting, right, the linemen and the folks on those crews through that training. But the reality is is no matter how much training you have, when you see somebody go into sudden cardiac arrest, it is going to be the scariest moment of your life. It is not a nice situation. Oftentimes it's violent. And oftentimes, no matter how you, if you've been through 5, 10, or 20 trainings, or in some cases, a trained professional, it's still a daunting task. And then lastly, the reality is that we all know on this call without saying it, there is some loose language from our friends at OSHA that talk about electrical hazards and what they expect for that sort of response to happen. And that can be interpreted a variety of ways. But do I ever think that we're going to see OSHA necessarily make a move and outright say they want them? In all of my time in this industry over the past 15 years, I would have thought it would have happened by now, but it's likely not to. What's been interesting, however, is the state laws that have started to creep towards mandates, right? I speak to California simply because we're a California-based company. And for anybody that might be on this call that's aware, there is a recent legislation in the state of California that does require AEDs in the utilities. And I know that's not the only state. So that might be the move on legislation, similar to what we saw in education. 10 or so years ago in K to 12 education, there weren't many laws that required AEDs in schools. If you look now across all 50 states, almost every state has some minimum baseline about an expectation of a standard of care for cardiac arrest in a school. All right. Now, as we jump into things, now we're going to address the gap, right? We talked about the reality. Now we're going to talk about the gap and this gap of the assumption of readiness to the hard questions that we're hoping each of you can ask yourselves about your own program. So I talked a few minutes ago about this 2% problem. And let me tell you the problem that we prescriptively realize and are trying every day of the week to address. Over the past 20 years, there's been approximately 5 million AEDs sold in the United States, right? And every year thereafter, depending upon the data you look at, there's anywhere from 250 to 400,000 AEDs sold every single year in the United States. Here's the challenge that we see with that. Of all of the cardiac arrests in the United States, there's a database from emergency responders that can capture different scenarios that they come upon during an emergency. One of those scenarios is cardiac arrest. Currently, what that database shows is that only 2% of cardiac arrests have an AED present on the scene with a victim when those first responders arrive. So everybody just think about this for a minute. 5 million AEDs deployed, life-saving devices across the 50 states. 350 to 400,000 devices being sold annually. And yet, only 2% of the time, when the heroes get there on the scene, a device is deployed. Deployment does not equal readiness. And this is our disease that we're trying to solve in the AED industry today. We need to create readiness in our programs, not just a check of the box of we have one. So what is the assumption that comes with this? It's what I think many of us in this space deal with on a regular basis. We have AEDs, we're covered. I'm sure some of you answered that poll question by going, we're fully covered, we're good, right? But here's the reality in that. And these are the tough questions that we want to start talking with and exploring and opening the door with all of you. Do you know where the locations of those AEDs are in a non-static environment? Yes, you may have an Excel spreadsheet that says where it is and says when the pads expire and when the battery expires, but who is ultimately responsible for the readiness and the understanding of the exact location of that product? From a maintenance standpoint, how are you guys looking at your maintenance program? We have noticed in the utility space, sometimes it's outsourced. Great. That is a considerable cost that you may be putting on yourself on that outsource. Sometimes you're doing it internally. Fantastic. But there's employee turnover. If those folks leave and there's a gap, is there a subset of your deployment that's not being checked based upon the manufacturer's indications for use, right? And third, the big piece, how much of your team that may be a part of that initial response team are unsure or hesitant about where that AED is, how to use it, and if they'd be willing to grab it in the case of one of their colleagues going into cardiac arrest? These are the types of questions and these are the types of assumptions and realities that we're trying to say, let's explore further. Let's go one or two layers deep. So what we've tried to chalk this all up to is, look, the setup is easy. You pick up the phone, there's 1,000,001 people who sell AEDs today, right? You can go and sell those, buy those AEDs. You can go and check the box and say you have them. And more importantly, you can do it and make sure that cost is going to be as low as possible. Okay, but here's the reality. The ongoing oversight of that program is where we today see the programs break down, right? Who's checking the devices? Who's tracking the expirations of those devices? Who is the one that's ensuring readiness on your fleets of those vehicles? Is it the crew that comes on and off every single day, having to check all of their equipment, also check that and report back? Furthermore, what is the reporting mechanism to be able to report readiness? And are you keeping effective records based on the manufacturer's requirements to do so? At the end of the day, team, we think about real-time readiness that it has to require more than just a passive approach. We need to be able to have a connected system, a connected solution that allows for us to not just think about is the device working, but allows for us to be thinking more about the system and the care by which that system is going to provide in that worst case scenario. So when we go deep with folks and talk about this, we kind of chalk this up to this false sense of security, right? So why are good programs that are AED programs that have maybe been implemented 10, 15, 20 years ago breaking down? Well, let's just hit the nail on the head. Number one, you've got a training issue, right? On top of an AED program and the readiness of the program, all of you have a training requirement for that program or in general for your safety. How much are you keeping up with the training specific to your AEDs? Are you doing it once a year? Are you doing multiple refreshers? Are you able to bring that and incorporate it into a more broader scale safety program review on a multi-time per year basis? You should. The maintenance burden. Kelly and I just had a long conversation with a utility not too long ago, and their number one challenge, it's the same we hear all the time, is look, these pads and batteries go bad, they expire. We just don't have a mechanism right now other than a human being who's getting pulled a million different ways to be able to check that. That burden becomes much larger when you realize that a percentage of your program has non-functioning product, and that percentage of that program with non-functioning product has no way to regularly check in and interact with the team that oversees it. The third piece that we say is devices move. If you all have fleet-based programs, I'm sure many of you can talk about the 1, 2, 3, 5 times where a device disappeared. This is a reality, mainly because these devices are of a small size. And with all of the equipment in the back of a bucket truck, those things can get misplaced, put in another place, left on a job site, and go missing. This happens way more than you may think. And the last piece of it, back to that scenario that I painted when we started the presentation, the general hesitation. I am friends with paramedics in my town who still tell me after riding for 15 or 20 years that the number one call that they hate going to the most is cardiac arrest. Because no matter how many times they've been there, it is the most challenging experience of their careers as medics. That's a medic that every day does this. Overlap that to the folks that have never seen a cardiac arrest and may be called upon to do it. What do we think that hesitation may be in saving their colleague's life? So I pose these questions to you all hypothetically as we keep the dialogue going. As those of you who responded to the poll question, right, no matter where your answer was, can you say today, with very little pickup or work, where is every AED in your organization by location? Can you say today which one is actively functioning in a ready state to be used, or which one needs you to go do maintenance on it? Are you able to properly answer who on your team is trained? Which crew members who have an AED on their vehicle have that necessary training to use it and save a life, and the necessary continued training to ongoing saving of lives? And do you guys have a contingency plan specific to your AEDs for those employees that may turn over, that may get promoted, that may move out of the current role that they're in, whether it be around their requirement to do maintenance in a decentralized program or just their requirement to continue to do the training that you may or may not have instilled in your program so far? What we would say, if you can't answer any of these questions immediately, number one, you're not alone, right? And I say it with a smile. We are paid every day and are fortunate every day to talk about AEDs 8, 9, 10 hours a day, right? We get a mission-driven focus to be able to share that. But guess what? For all of you on the call, I don't expect that you're thinking about AEDs daily, nor should you, right? This is a common thing that we see. And as we explore where we can support these organizations, we continue to focus on the readiness component, taking the program from good to great to excellent. This gap of readiness is what we want to be able to hang our hat on. So at this point, I'm going to turn it over to Kelly to let her talk a little bit about the shift, and then I'll jump back with you guys in a few minutes. Kelly, take it away.
Thanks, Mark. Mark talked a lot about the gap to readiness. And so what we're seeing is a shift in how AED programs are being managed. So historically, and maybe what you're doing today, it's a lot of manual checks, right? So checklist, inspections, maybe somebody on your team owns it. Until they don't, right? And those are some of the gaps that we're trying to solve for. Hence the reason for this shift. So especially in environments like yours, like the utility space, where you have mobile fleets, you have crews that are distributed or remote. That model of those manual kind of visual inspections starts to break down, and so we're going from this new thought process, this new shift of operational readiness and what that looks like. And so really the thought process goes from we think we're covered to we know and we can prove that we're ready and we're covered at any point in time, and no matter where our devices are distributed in a certain location or with a crew member. So what folks are starting to realize, so maybe some of you on this call, right, have already started to think about this, but assumed readiness is not enough, right? I always say trust but verify. So verification is really the new standard of operational readiness, right? So it's not just, hey, do we have AEDs? But it's kind of what Mark was talking about before. Do we know where they are? Do we know that they're functional? Can your team access them and actually use them without being concerned or worried or hesitant to do so? So manual oversight is not really scalable necessarily, right? When we're talking about who's maintaining the spreadsheet. How are we, if they're on a truck, how are we manually inspecting those? So we know when you have distributed operations that operational readiness becomes a little more challenging if you're doing this manual visual oversight. And so how do we overcome that? And that is what we're realizing is that visibility is required. You have to be able to have that visibility to the health status of your device in real time. And so if you're doing this, you're going to create a stronger program than maybe what you have today. So Mark asked some questions before, and you may or may not have been able to answer those. But if you have a strong program, that strong program is going to enable you to do a few things, right? To know where your devices are, number one. So if you've ever had devices that have taken legs and walked, which I'm sure most of you have, that's probably not a good, strong program, right? But if you know where your device is located and you know that it is emergency ready in real time, then that equates to a strong program. Being able to identify those maintenance issues proactively. We've heard before where there's been an emergency situation and somebody has that assumed readiness. They think they're covered and they go to grab that AED and the battery is dead. And so now you're just waiting with bated breath for emergency responders to get there. So a strong program would allow you to identify and proactively address those maintenance issues ahead of time. So you're going to know if battery needs to be replaced or recharged. You're going to know if your pads are nearing expiration. All of this is a more proactive approach, and that shows that you have a strong program. So again, going back to reducing the reliance on those manual checks. And we hear this too, like somebody's tasked with doing it. Let's say they're on PTO, they're on vacation, or their job just got really busy and they said, hey, we'll do that in 2 days. And that 2 days turns into next month. And again, next thing you know, we have a device that's not emergency ready, but we don't know it because there was a breakdown in who was responsible for maintaining the health of that device. And then activate emergency response, right? Mark talked about that 10-minute, right? And so reducing the amount of time it takes for an AED to arrive on scene. There are devices now that have an emergency response that is on the device itself, where it can connect to 911 when the AED is actually utilized. So again, just solving some of the readiness, operational readiness that you might think you have today. I hope by posing some of these questions, you're pondering and really thinking about your program and what a strong program looks like. Mark, next slide, please. So we talked about the reality of maybe some of your programs, the gap of some of those programs, how the industry is shifting and creating more innovation that can help ensure that you have a strong program. But now we're going to talk about how to build a program. So you're probably like, this is all great, but how do we do it? What do we do? Right. And so we're going to talk a little bit about what good luck looks like in practice. Right. So at a really high level, a strong program has a few things. Strong programs have a few things in common, right? So first is clarity of ownership and having centralized oversight. So we talk to a lot of people that have decentralized programs, and those are being managed all over the place, and there's no real like common ownership. So if you have one person, one team that's accountable, that also has visibility to the entire program, that's a good indicator of what a good program and a strong program entails. The next is visibility. And I would argue that this is probably the big one and the most important one is that you have visibility to the location, the status, and the readiness, knowing that your device is emergency ready in real time, and you have visibility to that. And then a defined response of expectations, right? So just knowing that depending on whether it's mobile and it's on your fleet or it's in a stationary location, that there are expectations to how this device is going to be tailored for that particular environment. So is there a point person on your response team? If the device you have visibility, you know that batteries are expired, what is the protocol? What is the response expectation to resolve those issues? And lastly is kind of regular review and improvement, right? So again, going back to that consistency, ensuring that devices are checked, they're maintained, and they're accounted for regularly. And if we're all funneling that up back to that clear ownership and that centralized oversight, you can ensure that you have a team that's dedicated to making sure all of these elements are happening, ensuring that you have a program that is sustainable, but it's also a strong program. And so oftentimes we think about, Mark talked about this early on, set it and forget it. I got it. I checked a box. We're good. It's on Bob's truck. We don't have to worry. But we know that, but that's where, common oversight comes in. It's truly that. It's the set it, forget it, and nobody's thinking about that device. And so hopefully this doesn't happen or it hasn't happened. But what we've heard from other folks is that yeah, the device wasn't emergency ready, right? They went to grab it and it didn't work when it needed to. We talked a little bit early on about one-time training or just training in general. So sometimes we get it and there's a all hands meeting and the safety team is there and we do some training on that device. But then there's turnover and there's attrition or folks just forget, right? And so that's something that we want you guys to avoid, right? And building a strong program, you should ensure that there is some consistent training. So whether that is something that is done similar to what we're doing today in a webinar style, or even on a quarterly basis, ensuring folks not just know where their AEDs are located, but ensuring they're comfortable with using it should their colleague succumb to a cardiac arrest situation. So again, just going back to ownership, ensuring that, I talked about this earlier, that someone owns it until they don't, right? And that's kind of passing the buck. Well, I thought this person was doing it, and I thought this person was doing it, and there's no common ownership, right? So again, don't fall into that. Make sure that there's clear ownership of your program. We talked a little bit about centralized programs. So again, wanting to build a strong program, making sure you're centralizing that, and compliance only mindset. So checking the box doesn't save lives. It's the first part, right? Ensuring that you have the AED, but ensuring that your device is operational and ready without having to call multiple people to dig through spreadsheets is really the key to ensuring that your device is going to be emergency ready and available to save a life if and when needed. So, quick self-assessment here. So we've talked a lot about reality of probably your situations and your devices. We talked a little bit about the gap and then the shift into operational readiness. So I think this is a good time to maybe pause and do some reflection about your current program, right? I know we started off with some questions, but as we've talked through this thing, you probably had some light bulbs going off. And so as you're reading these questions, I beg the question of, can you confidently answer yes to all of these questions? And as you're thinking about that, and whether or not you can confidently answer yes, or maybe you're sitting here kind of taking stock of your current situation at your organization. I'm going to turn it back over to Mark, who's going to talk a little bit more about some key takeaways, but also how to take some of the things that we talked about today and how to put them in practice to build this stronger, more confident, more reliable program. So, Mark?
Thank you, Kelly. Great job. So, team, I think as we're thinking about some of these questions, right, I think one of the biggest pieces of the questions that we hear from folks when they ask us about program breakdown, on top of all the things we discussed, is the reality of how programs are built to begin with, right? Which oftentimes starts with phase one, which may be covering some portion of your organization, and then phase two, covering another portion of your organization. And if that is a multi-year documented process for you to get to 100%, think about at every phase where things break down again, where ownership goes away. This is a very real thing that we see year over year in the utility space, where there may be an organization that says, phase one, we're going to make sure all of our real estate is covered. Phase two, we're going to do all of our trucks in Indiana. Phase three, we're going to do all of our vehicles in Ohio. Phase four, we're going to do all of our vehicles in Kentucky. Every single time you go through that phase should be the time by which you're reevaluating the past phases, because things will change as that gets broader, more decentralized, and lack of control existing. So, as you guys think about the key takeaways of our discussion today, first of all, I wanted to say thank you for everybody investing the time to do this. And for those of you that are going to be watching from downloading on the website, you are doing it for the right reasons and you are learning about this to be able to do it the right way. And for that, we're grateful. But really, it starts with the readiness gap, and we can't stress it enough, right? At the end of the day, the most challenging discussions we have is convincing somebody that it's more than just checking a box. And we're fortunate enough that so many safety leaders have either had their own experience with cardiac arrest, that they have started a program in a past life or their current life that has saved a life, and that they're supportive of what we talk about. But you can imagine there's a plethora of folks that go, I've got an AED, I'm okay, right? That whole verbiage of I've got an AED and I'm okay is exactly what we're trying to suck down to the second or third layer. From each of you on a day in and day out basis, we don't have to be the ones to tell you this. It's one of the most dangerous jobs in the world, working in the utility space. We know that. Those environments have a demand for a higher standard of safety that each and every one of you on this call tries every day their hardest to set. We want the AED program to be set at the same gold standard as the other programs that you have. From a visibility perspective, think about your program. A manual program that requires human beings, which I'm a human, you're all humans, we make mistakes a lot. But the requirement of that human in the chain of survival to make sure the life-saving device works, there's ways around that. There is technology out there today that can prevent a human from even having to interact with the product anymore. We can use technology to our advantage. And the efficacy of the program. It starts with accountability and ownership. It moves into the readiness in real time. And then it leads to the phone calls that Kelly and Victoria and I love to get. Hey guys, you're not going to believe this. We just deployed our AED program 1 month ago, and we just saved a 22-year-old lineman's life. That's the phone call you all want to get. That's the phone call we want to get. A program is a good thing. A program that saves lives is a great thing. Our ask of you would be take the first step. You're all very busy, but start with that honest assessment, right? Where are you today versus where you maybe want to be? I know there's some questions that have already come through, that there's been challenges that have been shared already, and that's where it starts. Let's open the dialogue. Let's open that. But it starts with each of you as the safety leaders to say, hey, I know I have a challenge. And then how do we start the discussion to be able to create solutions to that challenge? All right, as we move into the Q&A section, I think I just wanted to make a note for everybody. So we are going to be doing a giveaway of the AED that we have, which is the Avive AED. Just to give you guys a little bit visual about the product, this is me holding the device in my hand, right? There's a little bit of information about the AED itself, but as you can imagine, a lot of the things that we're addressing and that we're asking you all to think about in your programs are things that we talk about every day with help from the technology that comes with it. The way we're going to do the AED giveaway is we've got a randomizer from all of you that are going to be on this call right now. We're going to put that through the randomizer, and over the course of the next several business days, be able to get back in touch with the person who's earned this device. So we're very excited to be able to give it away and looking forward to getting some feedback from each of you. And I guess we'll leave you with a sincere and a grateful thank you. And we can open this up to some questions. We would suggest if you start evaluating your AED program, pressure test it. One of the great ways to pressure test it is if you have an AED program today that has a certain individual or individuals that are maintaining the product, randomly pick up the phone and call one of those individuals and ask them a couple quick questions. When was the last time you touched your AED? Can you show me documentation that all of your AEDs are 100% ready to be used and in working order? Can you show me the documentation of the maintenance records of those products? And then you can ask them, can you go and grab for me and pick a random AED that they oversee and see how long it takes for them to get back in touch with you to bring that back? The second thing that you can do is self-prescribe where you know there's gaps, whether it be on a training level, an accessibility level, a maintenance level, all of the things we talked about. And then we would encourage you, with our help, to start to understand what modern programs enable you to do. The way that we do this is through a complimentary assessment. There is no cost to this, right? We will come on site with you. We will sit down with you and your team. We will go through a bunch of questions with you. We will help you identify the gaps in your program so that you guys can say, I at least have documentation from an outside resource that's telling me here's some gaps of what best looks like, and then start having the internal conversations to bring your organization to that level. We do this on site. Again, it's completely complimentary. It is a great process for us to be able to help support you and give you that added encouragement along the way. If you'd like to partake in that, please feel free to reach out to Kelly. We're also going to have a follow-up email that's going to go out to each of you with some more about this that you can explore as well. All right. With that being said, I know we've got about 10 to 12 minutes left. Did we want to look in the Q&A to see if any questions are out there that we want to answer?
Yeah, I'm looking here. Got a couple questions coming in. And again, if you guys have questions, please send them in. Um, One of the first questions is I have so many issues with projects misplacing AEDs. Would love to hear a solution or different perspectives to help with this.
Excellent. Kelly, I'll take this one if you want. So I think this is a great example of the evolution of AED programs, right? So if you think about where we hear this a lot, right? New project comes up, AED goes on site, AED disappears. Today, there's two solutions that you can look at. One is a solution that is a non-native solution, where there is actually a monitoring piece of hardware and software that can be placed with whatever AED that you have, and it is listening and watching that AED to see if the device is working or not. Now, that is a monitoring solution that some of them may have functionality of GPS in them, some of them may not, but there are some solutions out there that offer that. Another solution is out there as a native solution, a built-in solution, where the product itself has a GPS signal. So I'll give you a story real quick on this question, which I think is important. We have a customer in the Southwest who they themselves deployed some of our products, which have a native solution GPS, and they had a situation where one of our devices went missing. And it was as simple as them going onto our software platform, going to the AED, and seeing on the map where the GPS signal was located. That company noticed that the GPS signal was in a residential neighborhood. They showed up at the front door of that residential neighborhood, and it was one of their subcontractors who walked off with the product. They were able to get that device back from them in real time, save them thousands of dollars in the meantime, and also address a very real situation with one of their subcontractors who stole something. Those solutions exist. It's a wide array of them. We're happy to talk to you about them in the areas where you can help capture how AEDs sometimes would go missing.
Awesome. Here, we got another question that came in. How do you best determine which trucks need an AED versus which do not for both gas and electric utility?
It's a great question. Kelly, do you want me just to keep going while I'm here? Okay, that sounds good. And if you want to add anything, please chime in. There is a there's a real situation here that I think that I would lay out to you that regardless of gas or electric, um, there is a what I would say geographic situation that you've got to address here before you think about even the where they're at and if they're touching wires or touching gas. And this comes back to this idea of how far away is a crew from the nearest AED slash how far away is a crew from how long it's going to take for a 911 call to come into a 911 center, then have that 911 dispatcher dispatch paramedics, and then finally get the paramedics to you. The reality is that timeline on average across the United States in an ideal scenario is about 8 to 12 minutes. So 8 to 12 minutes for a 911 call to happen, dispatch, and then getting on the scene. Well, what was the other statistic we shared with you today? For every minute that you're down in cardiac arrest, 10% less of a chance to come back to a normal sinus rhythm. So what we would encourage in that situation is let's look at your fleet. Let's look at where the nearest AEDs are to the fleet. And if we identify that there's a gap where time is not on our side, we're going to make sure that that portion of the fleet is fully deployed.
It sounds good. Got another question here. Someone had a question from their legal department on a couple days ago. Say a person needs an AED and one of our employee uses the AED to help that person while performing CPR, accidentally breaks one of the ribs of the person having the cardiac arrest. Would the employee company be liable?
Great question. So, first of all, I'm going to start this by saying that I am not an attorney. I am a passionate gentleman who has committed my lifelong mission to making sure we have life-saving devices out there. From our experience on this, this comes back to the idea of one single thing, the Good Samaritan laws and how they exist, coupled with the fact of has there ever been an existing incident that has created a legal precedent for that situation? Every state has a Good Samaritan law. And in just about every single state, with exception to one or two, that Good Samaritan law says that if you act in good faith to save a life, you will have immunity. Now, the real question that comes up with this has more to do with what we just spent the past hour talking about, where organizations are more concerned about, yes, they may have a Good Samaritan law that exists, but what documentation do we have internally around our AED program and who should or shouldn't be using it? We refer to this often as public access programs versus trained responder only programs. At the end of the day, the best programs unequivocally are anybody can grab that device and use it. But the reality is there's been very little, if any, successful cases that have ever been where a good Samaritan tried to save a life and was unsuccessful because everybody knows the common denominator is if that good Samaritan didn't try to save a life and didn't try to start CPR, that person would be dead anyway. Because when you're in a fatal rhythm, the only thing that can save your life is the successful shock from a defibrillator and the CPR to keep that oxygenated blood flowing.
All right, looks like we got another question here. You mentioned that technology advancements have really started picking up in the last 4 to 5 years, but regulations don't always keep up with technological advancements. Things like periodic checks, tampering, etc. Does emerging technology meet regulations around no longer having to do physical checks slash remove the hands-on element?
Great question. So thank you, anonymous attendee, for submitting that, first of all. I would say that the best way to answer this question, it has a lot to do with the state laws. Many of the state laws talk about the fact that you need to follow the manufacturer's recommendations for maintenance. There are several states that are out there today that still say that you need to do some sort of manual or physical touch. In fact, there's even some local laws in certain states that still encourage that. So while technology may have advanced, there may be areas of a program where if the technology is doing a remote level system of care or oversight, that there might be two or three or four areas of your program where you still have to do a more hands-on. I feel as though that we are going to hopefully progress past that and get through that, where those laws will change. But in the interim, the way that we typically address it with a potential client is we identify where those laws are ahead of time, and we work with you to be able to say, these are the gaps that we're not going to be able to use technology to automate today. Let's focus our efforts on documentation on those key geographic areas, which will ultimately enable us to be able to put us in a position so we can say, while the laws aren't there with the technology today, we are still 100% compliant, 100% ready for our system of care to save a life.
All right, we got one more here. We had a save by using maybe more of a comment. We had a save by using our AED on one of our citizens that went into cardiac arrest. So just a comment there.
That's awesome. Congratulations, Dennis.
All right, if there's we're about at top of the hour here. So again, thank you guys for joining us. They'll be in contact with the winner of the AED, and this recording will be live up tomorrow if you want to share it out with your team on incident-prevention.com. And if you're coming to the IP conference, stop by their booth, talk with them. That's what they're there for. And again, thank you guys for being here.
Thank you, everybody. Have a safe day.
Have a
Thank
great
you.